Hello, I'm Lucy from Pinkham Equine. What we thought we'd do is put a few webinars online for people to access whenever they like. And we've done a few talks in the village hall for clients, and they've been well attended, but we thought this might reach a few more people, and obviously it's in your own time and not a fixed time, so that makes it more accessible for everybody. I'm just going to run through an overview of breeding of the mare for this first webinar, so just covering the basics really, and then I think what we'll do is put on some more detailed ones, maybe an embryo transfer talk a bit later in the year, and we'll try and put on varied talks about other subjects as well throughout the year as and when they come up. So for those who don't know, we're Pinkham Equine. We're based in Whitsbury, just north of Fordingbridge. Charlie Pinkham started the practice a couple of years ago, and I joined him this year as he was getting busier and needed a second pair of hands. We cover sort of Hampshire, Wiltshire, Dorset area. Breeding is one of our main areas of interest, which is why we're going to run through breeding your mare today. So you might have a mare that you're thinking about breeding and don't know quite where to start, or you might already have bred foals and you just want to maybe try a different technique, or you've got a mare that you're not sure about. So we just run through some of the basics and hopefully what we're able to offer in amongst that as well. So firstly, we should consider, is my mare suitable for breeding? Not all mares are. What's her general health like? Has she got Cushing's or laminitis? Is she lame? Lameness is a common reason why people breed their mares, but is it going to affect her carrying the foal to term? Is it a genetic? Is it something that's going to crop up in the foal as well? Is that a good idea? Cushing's might prevent her getting in foal in the first place and carrying the foal to full term. What's her temperament like? Is she going to be amenable to us breeding her? We've got to scan the mare regularly and handle her regularly. Also, is she going to pass, if she's got a very difficult temperament, is she going to pass that on to the foal? It's often hard to tell. They often become quieter and it calms them down a bit. Having a foal, the responsibility seems to do them good. So some mares become quite placid once they've had a foal. What's her previous breeding history? Maidens are generally straightforward. Young maidens under 5, we'd consider them straightforward breeders in most cases. Older maidens, so sort of older 12 that have competed and you know, that at the other end of their career, they can be more challenging, but as long as we're prepared for that, they're normally okay. They're actually often more amenable to AI than they are to natural cover. But we'll talk about why that is a bit later on. What's her perineal conformation like? So if you stand behind her, does she look like this one up the top here, or does she look like this one down the bottom here? This mare here is going to pass feces into her vagina very easily. She's going to suck air in. All these things can compromise her chances of getting in foal and then holding on to a foal once she's in foal. What's her work schedule? As you know, are you still wanting to compete this mare? Might embryo transfer be something to consider doing so that she can carry on competing? What's your budget? That's important. Obviously there's sort of more intense systems which cost a bit more money, or very straightforward natural cover which can be done on more of a budget. And also, what facilities have I got? We do often scan mares around stable doors and don't always have stocks, but it obviously helps if you have got stocks. So where should you start? I suppose the first thing to do is have a chat with your vet and get the vet out to have a look at your mare and check her over and see what we think, see whether she's a suitable candidate for breeding. Can we predict any problems she might have? Any extra sort of costs along the way? What's her general health like? And then the bit we would do mainly is her reproductive health, so an external examination of her conformation, and then an internal examination, and we'd look at her cervix or a spec, and ultrasound, a thorough ultrasound of her whole uterus and ovaries. So this up here is an ovary, and this is a cross section of a uterus, all looking very normal. Do we need to do anything prior to breeding? Any bloods, swabs? So there's a few transmitted diseases that we sometimes take bloods for, particularly if they're going away to stud. EVA, strangles, people want to know about EIA, swamp fever, and then swabs pertaining to whether there's CEM, so whether if she's going to a stallion, whether she's carrying anything she shouldn't, and also then the relevant swabs for us, whether she's got any bugs that might inhibit her going in foal easily. Stallion, which stallion you want to go to, that's to some extent that's your decision, but we may be able to help you. We may know things about his fertility and the types of semen that are available from that stallion, and how successful it is, and whether that's a good match with your mare. What's his fertility like? That's important. If it's going to cost you £1,000 a straw of frozen semen, and you find out that his fertility is really hopeless, then that's probably not the place to start. And how they suit your mare. You know, a subfertile stallion with a subfertile mare, you're running into problems. If you've got a problem mare, you need a really fertile stallion, and we can probably help advise on that. And then also you need to think about whether there's any further techniques required down the line. So embryo transfer is something to consider, particularly in competition horses, and it's not something just to decide to do at the last minute. We need a bit of planning and preparation for that, so have a think about that beforehand. What's involved? So with whatever way we breed the mare, there's a regular scanning involved. It depends a bit on how lucky we get with her cycle and how consistent she is with her cycling, but we'll normally need to scan her a couple of times prior to breeding at least. And you know, whether she's got problems and we need to swab her or anything like that can alter that, but she certainly will need scanning a few times. And it varies a bit depending on what breeding technique you're using. She will need to be restrained. As I said, stocks are the ideal, but they're not necessarily the norm on just private yards. We generally would do them around a stable door or over bales. They often will need sedation if we're doing that like that, particularly the first couple of times we do it, just to get them used to doing it. Most mares tolerate it incredibly well, considering. Some we would twitch, but obviously if your mare doesn't accept the twitch well, then let us know. We don't want to upset her. We want to keep it a nice, calm, sedate experience for her. There is some risk to the mare in scanning, so we need her to stand as still as possible to reduce any chances of a rectal tear. There's also obviously a risk to the person holding the mare and a risk to the vet who's got their arm in the mare, so safety is paramount, and if we need to sedate them, we will. But generally, I'm always amazed how well mares put up with us doing what we need to do. They get used to it very quickly. It does take time, so it might be for frozen AI, for example, you might need a few visits in one day, so you need to either work out how you're going to arrange that to happen. Can somebody be around to help us, or maybe take a few days off, so you just got to fit it into your schedule. And also the cost, it can add up depending on how, you know, you've got to be prepared for, yes, in an ideal world all mares would go in foal on the first breeding, and that would be as much as you spend, but some mares do take a few breedings, and actually that's something important to find out from the stallion end, what the contract is. Are you getting 3 breedings? Is it a live foal fee? Do you just pay per straw of semen, in which case there's no terms at all, you don't get any comeback if the mare doesn't go in foal? Or do you get 3 doses of semen? That's definitely something to work out before you start, because you know the hidden sort of costs. If it's paying per straw, it might seem a great idea until you're on your 3rd straw, which is £1,000. It's not so good. You might have been better paying for a live foal fee, which is normally a bit more, but does cover you if it all goes wrong. So how do we know that your mare's ready for breeding? So from the repeated scanning, what we're looking for is that she gets this nice big dominant follicle over 35 millimeters, and she's got edema, so there's folds here. You can see these folds of edema. Her uterus is active. It's under estrogen dominance. So here we are. There's a spike of estrogen which is produced by this follicle here, and that stimulates edema to form in the uterus, so we know she's in season. This LH rise causes the final ovulation to happen, and this is where we can, this is a drug we can give her to increase her chances of ovulating. And then once she's ovulated, everything drops down and progesterone becomes dominant again, and when she's pregnant, progesterone stays dominant right the way through. So we know she's ready for breeding when she's got a large follicle over 35 millimetres, she's got an edema score of 3 out of 3, and she's teasing well if we've got a teaser. That's not so important, we can go off these signs, but it's always nice to see that she is showing. Some mares will show to other mares over the fence, and that will give you a good idea when she's getting close. And then the ovulatory agents induce ovulation in 30 to 42 hours depending on what we use, and there's some various ones, but they mimic they either mimic LH or they mimic a precursor to LH and FSH, and they're quite reliable for making them ovulate, so that's really helping us out. So as far as breeding a mare is concerned, what are the options? Well, there's natural cover, which you might just chuck them out in a paddock and leave them to get on with it, so that's really natural cover. Or there's in-hand covering, so as in the thoroughbred industry, all mares are walked into a shed and covered in hand with the stallion. It obviously takes some skill on the stallion handler's part and the mare handler's part. And then the bit that we're more involved in is artificial insemination, and that can be with fresh, chilled or frozen semen. We do some embryo transfer, and then you've got advanced techniques like intracytoplasmic sperm injection and cloning and stuff, which haven't quite reached Whitesbury yet, but they're definitely, particularly ICSI is going to become commercially available in the UK in the next few years, and that's quite exciting. We might do a talk on that later on in the year. Natural cover. So natural cover, there's two ways of doing it. The old-fashioned way, teasing and covering. So if you've got a teaser pony or a stallion, or some mares will show to geldings, but it's not so reliable, you can tease her until she's showing well, and then you cover her, and you cover her every other day until she teases off, so she stops showing to the teaser stallion. Now that actually it's how it was always done historically, but it does take quite a lot of you've got to have a teaser pony and the right setup, and B, it takes quite a bit of skill and knowledge on the handler's part to pick exactly when the mare is going to be coverable, and also you need a stallion obviously on site, or you need to be prepared to go to your stallion a few days in a row. And then the next option is scanning and covering, and this is a vet is required to do this. We scan probably every other day until she's getting close, and then daily until she's nearly ready, and we can predict when she's ready to go to the stallion and book her in. And this is how the thoroughbred industry works. A stallion might cover 4 mares a day, so we're trying to book a slot. We're working out the exact best time for cover for that mare. The downside to natural cover is obviously disease transmission, because they're actually getting covered, so the mares being covered naturally should be bled for EVA and EIA. EVA can be carried in semen, so it's important to test mares before they're covered, so that you know where the infection came from if the worst happened. Swabs for contagious equine metritis, which we have in the UK, so that's a clitoral swab and sometimes a uterine swab as well, and then swabs for Pseudomonas and Klebsiella, which are venereally transmitted, so it's important that we swab for those before cover. Not all studs will require these. In the thoroughbred industry these are mandatory, but in sport horse breeding it's at the decision of the stallion owner, so that's up to them. But be sensible to, I think, to test your mares before they go, so that if the worst does happen, we know that they were clear before they went. So you might do a walk-in cover, or you might board your mare at stud. So a walk-in cover, we would work out exactly when she's best for cover and send you off on that day. Boarding at stud, she might go and be teased, or she might go and be scanned by their vet and covered as and when, and then come back to you once the job is done. Natural cover, generally most stallions' fertility is good enough that we need to know they've ovulated within 48 hours of a natural cover. Sperm will last that long fairly easily from most stallions. There's obviously more risk to the mare, the stallion and the handler for natural cover. There's especially if the mare is not quite in season. There's often feet flying around, and you need to be an experienced handler to do it successfully. It is the most has the highest success rate, 60 to 80%. It's the natural way of doing it, so that kind of stands to reason. We're not messing around with too much at all. So Then it starts to get a bit more interesting. AI now with fresh semen isn't done that commonly. This is when we collect the semen and immediately inseminate it into the mare, so there's no transport of the semen at all. So the mare needs to be on site. There's obviously, you'll wonder why we don't just naturally cover them. Some sport horse stallions particularly have never covered a live mare, so they don't want to risk the stallion or the mare. Sometimes the semen is extended, like this has been. Sometimes it's just put in raw. It depends a bit on the stallion. This is used in subfertile stallions, semen that doesn't last much time at all, doesn't transport well, to give them every chance of getting the mare in foal. Is deposited in the mare straight away, so it's obviously a bit more time consuming. The mare's got to be there. It's not as straightforward. It sort of loses some of the advantages of AI, but it certainly is used, and you can split the dose into multiple doses, so you could have 3 mares in season at one time and inseminate them all at the same time. So that's quite a useful thing. Your stallion only needs to jump once. It's got similar success to natural cover, although the caveat to that is it's often used in subfertile stallions, so the stats are a bit biased against its success, but if it was used in normal stallions it would be about as successful as natural cover, and as I say, it's rarely used commercially except in problem stallions. So then moving on to chilled semen, which is the most popular method for inseminating non-thoroughbred horses in the UK, I would say. It's fairly straightforward to do. We can do it on site. They deliver all across the UK, and it means we can get semen from Europe and the UK, all within sort of a 36-hour window. So we scan the mare once she's ready. We contact the suppliers and make an order. The only things that sometimes do limit us is that we're dependent on the shipping companies. That means that we are often Tuesday to Friday dependent for insemination. If it's a UK based or coming from Ireland, it might be Saturday morning as possible as well. Or obviously if it's in the UK, then there's often the opportunity to go and pick it up yourself, but we are a bit limited by the transport companies. But the semen is collected, it's chilled to 4 to 8 degrees centigrade, which allows it to last sort of 36 hours with an extender to give it some energy, and it's shipped in a convenient package to the place where the mare is, or direct to us. We need the mare to ovulate within 24 hours after insemination, so we don't need to be as accurate, but a bit more accurate than with natural cover, because it's already been around for 36 hours before it goes in. Still recommend that we EVA test these mares. Semen can carry EVA. If it's coming from a reputable place in the UK, it should come with health papers, and if it's coming from Europe, it should definitely come with health papers. So we don't always do this, but if belt and braces, we perhaps should be doing this. Success rate is really good. I've said 60 to 70, it's probably sort of 50 to 70. It depends very much on the stallion and the quality of the semen that you're sent, and the quality of the person collecting the semen and shipping the semen, extending the semen, as to how successful it will be. Frozen semen is a bit more technical. It obviously gives you an increased choice of stallion. You can use A, worldwide stallions, and B, semen from dead stallions that can be stored for years. It's sort of indefinitely stored. I think I've used some from 1983 before, and it's normally stored at an AI centre, and then we can order it prior to wanting to breed the mare, so we can be prepared before she even cycles, and then or we can have it in a transport tank, which still lasts 7 to 10 days, so there's no need to be quite so worried about ordering it on time. We can have it there before the mare's going to need it, so we're all prepared. So we're not reliant on delivery times. We can do weekend inseminations, middle of the night inseminations, that's fine. It does require an increased accuracy, definitely. There's more scanning involved. It's the one insemination that we do post ovulation, or ideally at ovulation. So we need to be scanning these mares. We give them ovulatory agents so we can predict roughly when they're going to ovulate, but we need to be scanning them certainly towards the end, every sort of 6 to 12 hours. If we can predict it fairly easily, but on the last day prior to ovulation we will need to scan her a few times just to make sure we get it exactly right. You've got a 6-hour window post ovulation, so we've got to be within that 6 hours of ovulation, so it's a lot more accurate than the other forms need to be. Success is determined by how well the stallion semen freezes. Various stallions don't freeze well, some freeze very well. It also depends who does the freezing and what extenders they use and how good they are at doing it. So that's the main variable for frozen semen. Some mares do react badly to frozen semen, and there's often a lot of dead sperm, and that's what causes inflammation and fluid. So if you've got a mare that already produces fluid and cervix doesn't relax very well, then frozen semen might be going to cause even more of a reaction in her. The success rate is less. It's probably 10 to 15% less than chilled, 40 to 50% per cycle, and again that's dependent on the stallion really, and the mare to some extent. So depending on what way your mare has been bred, it is how soon after insemination we need to check her. Obviously with a frozen mare, we know she's ovulated because we inseminated her post ovulation or at ovulation, so we need to leave at least 6 hours before we scan her again and before we put anything in the uterus or flush the uterus at all. In your natural cover mares, we'll be looking at them 24-48 hours post insemination to see what they look like, to check that they've ovulated. We're checking for that they've ovulated successfully, so here's a nice ovulation. We're checking that whether they've got multiple ovulations. She could have 2 ovulations, she might ovulate 1 and still have a big follicle that we need to just remember was there in case when we come to scan her there's a risk of having twins then if she's had 2 ovulations. We're looking for fluid in the uterus, which is what this is, and then the mare might need treating. So we will lavage the uterus to dilute the contents to get rid of bacteria, to get rid of fluid. We'll dilate the cervix to help her get rid of fluid. We might use antibiotics if there's good evidence for it. We might use other non-antibiotic agents, mucolytics that break down the mucus or the biofilm that bugs live in and allow us better access to the bugs with our antibiotics. And we're almost certain we'll use some ecbolics. So a drug called oxytocin is the most common, which causes uterine contractions, pushes all that fluid out before the cervix shuts. We've got 1 to 4 days after ovulation to treat them. Most mares we look at the next day, they look good, that's it, we wait 14 days to scan them. Some mares take the full 4 days of flushing and treating to get them clean, ready for this pregnancy. That's the little embryo that's up in the oviduct comes down into the uterus at about 6.5 days. So during that 5-day window we've got time to make sure it's clean and hospitable for the embryo when it arrives. And then the final thing we'll do to these mares when we're done cleaning them up is caslick them. So that's to stitch them, like this mare here has been stitched, and like the mare on the first slide, to prevent her taking feces and air in through the cervix and into the uterus. So we will caslick a lot of mares. It's made the biggest difference to horse breeding since the caslick was invented. So we are quite keen to do it if it needs doing. If your mare's got good conformation, then obviously we won't stitch her. Now, so then the exciting bit, when do we know whether what we've been doing has worked? So we'll scan a mare 14 to 16 days post-ovulation. Double ovulations, if we know there's been a double or we're suspicious there could be a double, we must scan those prior to 16 days. That's when implantation occurs. If the twins right next to each other, we can't move them apart once they're implanted, so the chances are we might squash both of them. We want to look at them before 16 days when we can move them apart and squash one. I'll explain in a minute why we have to get rid of one of the twins. We will normally recheck mares 2 days later, particularly if we know there's been a double ovulation. Sometimes if we don't know how many ovulations, if we didn't breed the mare, we're just checking for pregnancy. Always sensible to recheck 2 days later to make sure there aren't twins, because twins can be different sizes. It might be that one was too small to see at 14 days, but by 16 days they should both be visible. So we're looking for a 12 to 18 millimetre vesicle. So this is a nice sort of 14-16 day pregnancy sitting in the uterus here. So twins, what do we do if there are twins? Mares are really unlikely to carry twins to term because of their type of placenta. They have a diffuse placenta, and those twins would both need an equally sized placenta in order to survive. So it's really rare. The most common outcome is that they lose both pregnancies, which is why if we see twins on scan, we will squeeze one of them. We just take it away, move it away from the other one, and just pop it, and has a good success rate if done prior to implantation at 16 days. After 16 days we can squeeze them, but if they're right next to each other like these two, the chances are you might get some release of prostaglandin and inflammatory mediators, or you might physically damage this second pregnancy. So we like to do them before 16 days, and with a competent technician, so someone that's used to squeezing twins, it does have an over 96% success rate prior to 16 days. So that's obviously really good compared to the chances of losing both pregnancies later down the line. They will resorb one if they're both in the same horn. There's quite a good chance of resorbing them, but the success of squeezing them negates the need to risk it, really. So we will squeeze twins if they come up. What follow-up scans do mares need? So 28 days, heartbeat is visible. Actually, with the scanners we use, we can probably reliably see a heartbeat from 23 days onwards, and sometimes even 21. We do a 42-day scan, 42 to 45-day scan, and that's because in the mid-30s, some of the hormones in the pregnancy change. These things called endometrial cups appear on the wall of the uterus, and they produce different hormones, and that's a sort of tricky time for the pregnancy. So we're just checking that they've made it through that mid-30s period and that the pregnancy is still stable and still has a heartbeat. And then excitingly, at 60 to 65 days we can do gender determination. This guy here is a colt, that's his genital tubercle there, and then this is his back legs here. That's the umbilical cord, and sitting just behind it is his genital tubercle, which will become the penis and testes. And here, this is what will become the clitoris of a female. This is her anus, these are her legs here, tibias, and then this is the clitoris there. So with careful scanning, with some skill, between 60 to 65 days, 63 being the sort of ideal that's always quoted, we can tell you whether you're having a colt or a filly, and that can help you make decisions about what you're going to do with that in the future, help you plan for the next season. And then some mares need scanning through to term after the 60 days. If they've had placental issues before, we might monitor their pregnancy, or if they start to produce discharge or worry us in any way, then we can do placental scanning right through the pregnancy to monitor its progress, and maybe it will need some drugs to help support it during that time. Right, so embryo transfer is really exciting. Both Charlie and I are experienced in embryo transfer. So the basic principle of embryo transfer, for anyone who doesn't know, is you take a donor mare, so a mare that's out competing. Most commonly, it's because they're still young and they're out competing and they don't want them to have a year off to have a foal. You don't want to stop a mare in its prime. It also enables you to have multiple offspring from one mare and realise her full genetic potential. So you could get embryos off her when she's 4 or 5 out competing. You might get 3 embryos off her, breed 3 different foals the next year. They'd be ready to go in 3 or 4 years time. It speedens up the time to which we know whether that mare is a useful brood mare or not. It used to be you'd have to wait till they were 15 or 16 and finish competing, and then you bred from them and you maybe got 1 or 2 foals out of them. Now you could potentially get plenty to see who's going to be any good. So you breed her as normal, you take the embryo, you flush the embryo out of the donor mare and you put it in a nice recipient mare here. These mares are normally between 4 and 10 years old, maidens or easy breeders with a proven history with good perineal conformation is the main thing, and that scan well, they don't get fluid, they're easy to breed. We put the embryo in her and then 11 months later we get the foal. So what's involved with this? So the donor mare needs to be synchronised with the recipient mare. Not so easy in mares. Cattle you can synchronise really easily. Horses aren't so easy, but we use some drugs and we scan them every other day and try and speed one up or slow one down depending, and try and get them lined up. So provided we've got a recipient that's synchronised, we can breed our donor mare as normal, whether that's natural, chilled, frozen AI, whatever, that doesn't vary. The same process as normal for that. The recipient, we want her ideally to ovulate 1 to 3 days after the donor mare. There is some flexibility in that if that's all you've got, but in ideal circumstances we want to be in this window here. 7 to 9 days later, depending on what way the mare was bred and how big we think the embryo is going to be and how old the donor mare is, we flush the embryo out of the donor mare, or we do a flush and look for an embryo. We hope there's an embryo there. If there is an embryo, it's really fragile, has to be carefully handled and washed and loaded into an ET gun. And then each embryo, whether it's 1 or 2, is transferred into a separate synchronized recipient. So if you've got a double ovulation, you need to synchronize 2 mares. So it can get quite tricky to juggle them all. And then the recipient is scanned at 14 days, exactly the same as a normal pregnancy, but the pregnancy is from the donor mare's ovulation. That's how old it is, not from when it was put in the recipient. So this looks a bit hectic, but it's just a quick sort of diagram of what happens. You've got your donor mare plus your stallion, your donor mare, so you inseminate with his semen, the donor mare ovulates, and at the same time you've synchronized the recipient, and 3 days later, well, 1 to 3 days later, she's ovulated, so you've got a nicely ovulated recipient there. The donor then 7 to 9 days later, we flush her, so there's fluid hanging up here, it comes down this line into her uterus, fill up the uterus, and then once it's full we close this off, open this tube down here, and it runs out through a filter that looks like this, and there's a very fine mesh in the bottom of the filter that will collect the embryo. It's very carefully taken into a nice clean lab, emptied into a dish where we can look under a stereo microscope, and we're searching for the embryo, and what we're looking for is this tiny little circle here. That's what an embryo looks like down the microscope. This is what it looks like down a better microscope. That's a nice expanded blastocyst. That's a really good grade embryo. We grade the embryo, we age it and sort of decide on its chances of survival, and then it's a case of moving the embryo around, washing it in various clean solutions, and then we load it into one of these semen straws in a special way, and that straw is loaded into a gun like this, and this little hole here is where the embryo pops out. That's passed through, the recipient mare needs to be immaculately cleaned up and proper sterile procedure like you would for surgery, and this tube is passed through her cervix, and then the embryo is released into her uterus. 14 days later we scan. This is what we're looking for, a nice little vesicle, which is the age of this ovulation. So it's from when the donor mare ovulated, not from when the recipient mare ovulated. And then 11 months later, this is what we're looking for. So this little foal here is the offspring of these 2 up here. But she's been merrily competing away while this mare here did all the hard work. So the bit that takes the skill is this handling in the lab. Embryos are very, very delicate and can be damaged very easily. So who can do ET? It is a skill process, it takes training, it's not something you just have a go at. Specialised equipment is needed, although it's not a huge amount. The main thing you need is the skill and the training to have done it. The embryo handling, it needs to be really careful. You can damage these embryos really easily. You can pop them, you can drop them. They're tiny, tiny microscopic things. Hygiene is essential. They can be sensitive to any sort of dirt and dust, and they can also be sensitive to detergents and cleaning agents and any sort of toxic residues that are left. So everything has to be immaculate and clean with no residues. It takes some planning to get a successful result. If you do it well and you do it properly, if a job's worth doing, then do it really well. And with that, with proper planning, it's not something to decide to do at the last minute. Now, you do need recipients in an ideal world, and that can be a problem in the UK. People haven't got space to run any recipients. They don't have mares just hanging around at home that we could use. So we tend to do transported embryos, and this is where we flush the embryo out and we transport them in one of these equitainers like semen is transported in. And they'll survive very well transported for up to 24 hours, and that allows us to send them to an embryo transfer centre who have a large recipient herd. And obviously if you've got 50-60 mares that you're scanning every day, the chances of finding one that synchronises well with the mare that we are getting an embryo from is much higher. So we'll tell them that this is what we're planning to do, we'll keep them posted as to where we're at, they'll choose us a mare or two of theirs that are lined up with our mare. We'll do everything up to flushing the embryo, and then we package up the embryo and send it off to them, and they'll put it in one of their recipient mares. And then you can either leave the recipient mare with them until it foals, or take the recipient mare to your place, and provided you return her at the end of the year looking all right, then that's how the system works, or 18 months as it is by the time the foal is weaned. Problem mares is a particular interest at Pinkham Equine. Both Charlie and I are quite experienced at stud work, and difficult mares is a good challenge for us. We really enjoy that. So we do subfertile mares investigations. We'll do a thorough exam, get a really good history that can give you a lot of clues as to where the problems might lie. We've got really good scanners with Doppler, so we can look at the blood supply to the ovaries, to the follicles. Can be really useful. We've got the facilities to swab and take low volume flushes. We do a lot of our own in-house microbiology, which is useful because we get results very quickly. We take uterine biopsies, so here's some biopsy samples that can tell us what a mare's prognosis for future breeding is. If she's got a lot of fibrosis, then the chances of her carrying a foal are slim. Not necessarily impossible, but biopsies can be very useful. Hysteroscopy is something else I'll go on to explain a bit more about that. That's when we scope the uterus and have a look inside. Oviduct flushing, so we can arrange referral for this. Mares sometimes get their oviducts get blocked up, particularly older mares, and they're failing for the embryo to make it into the uterus, and it's quite a simple laparoscopic procedure that we send them for, and it's often very successful if you choose the right mares to send, mares that you've tried everything else and nothing seems to work. And then placental scanning is the other thing we can offer, so monitoring high risk pregnancies, which is an area of interest as well. So the hysteroscopy is putting a scope into the uterus. It allows us to look at the general architecture of the uterus. So this is the bifurcation of the two horns. Look at the surface of the uterus, see if there are any areas of fibrosis. We could take a guided biopsy of areas that look suspicious and areas that look normal to compare the two. Cyst removal can be done hysteroscopically. And then this is an oviductal papilla. So this is where the oviduct enters the uterus, and it's useful to see. We can do very low dose insemination by using the scope to drop a very small dose directly onto the papilla, so that the sperm doesn't have to swim anywhere, and that's a useful tool. If you're only getting sent one straw of a subfertile stallion, we can maybe increase your chances using that method. So that's it for the talk today. That was just a brief run through of sort of general breeding outlines and what we can offer. I hope you enjoyed it. If you've got any questions, do give us a ring or email us. We're always available to chat. As I say, hopefully we'll get a few more of these up and running, some other topics, maybe non-breeding related. Charlie might do some lameness ones or leg ones. I might do some more breeding ones. Just to keep everyone's interest, and as you can enjoy them at your own time at home, which is a bit easier than having to come out in the cold to the local village hall. Good, I hope you enjoyed it, and yeah, don't hesitate to get in touch if you need to ask us anything.